much water should you drink after bariatric surgery, gastric sleeve, gastric bypass, duodenal switch, SATI, SIPS, all the operations? Hey, I'm Steph Wagner. I'm a dietitian. I support bariatric surgery patients in their everyday life in between their follow-up appointments with their team. There's a couple different ways to approach how much water, and every program will differ a little bit. You'll hear me say that quite a bit on this channel, and that's okay. There's professional opinion, there's different approaches, and each patient is individualized. So the official recommendation is to divide your current body weight in pounds by 2.2, puts your body weight into kilograms, and the recommendation is 1 ounce per kilogram of your body weight. Now, for some, this will be a very overwhelming amount because 64 ounces, which is the traditional recommendation for an adult, is assuming that person weighs around 140 pounds. For a larger body, it's going to be a very big amount of water, and it's like, how on earth am I supposed to drink that much water? Well, the counter to that is to try to get closer to 96 ounces or 100 ounces instead of 64 ounces if you're trying to hydrate a larger person than 140 pounds. All that to say, I like to recommend 64 to 96 ounces of water a day. The more the better. So in my last video, I mentioned that I like to talk about the 5 pillars of healthy living. And this is true for anyone, but I coach from the bariatric surgery perspective. And on our pillars, the first one is water. It's followed by meal planning and food quality, movement, sleep, and vitamins. So when it comes to water, I have often felt that we kind of diminish just how powerful it can be. It's like this secret weapon that we forget just what a powerful punch it has. I hear all the time from post-op patients that got behind on water, they haven't been tracking it, they're not really paying attention to it, and then they really start working on building up the habit of getting more hydrating fluids in. They're usually like, oh my gosh, wow, I feel so much better. I didn't realize just what a big difference that would make. I see that all the time with increasing water. It makes sense. Every single cell in your body needs water. Brain cell, stomach cell, blood cell, all of them. That's why our bodies are made of 70% water. So the better hydrated we are, the better our body can function. A well-hydrated body will have more energy, will then get more movement in. More movement leads to more sleep. It also helps to manage appetite. Our brains often confuse thirst and hunger. We might be more grazy and snacky when we're dehydrated because we're missing those cues in the brain. But it's also why they say if you drink water before you grab a snack, you may find that it curbs your appetite because a lot of times what we really needed was water. Now there's a few things we need to talk about when it comes to water after bariatric surgery, and first is the fluid with meals rule. It is kind of an outdated recommendation that you can't drink before your meal. That was updated, and so now you can drink up until your first bite, but whenever you start eating food solids, your chicken breast or hamburger patty, put your fluids away. Take small bites, go slowly. When you're done with your meal, you want to set a timer at least for 30 minutes, if not 60 minutes. But set that timer so that you remember to get back to your fluids. It's not uncommon that that 1 hour of not drinking turns into 2 hours and then having a hard time getting enough water in. Now, I often get the question on if that rule is true for life. Do you always have to avoid drinking with your meals? Unfortunately, yes, that is a true for life recommendation because your anatomy has changed, and that means that food can move through the post-op pouch more quickly. If you drink with a meal, you might be able to eat more, have a bigger portion size, and feel hungry sooner because that meal is leaving you sooner. That's really the take-home message with keeping your liquids away from your meals because you have better portion control and fullness for longer, which leads to better hunger control, better weight control. Now, it is really important to get all of your water in between your meals because we are taking those chunks out of your day where you cannot be drinking water. And this is why we don't tend to recommend small frequent meals, or why grazing can get in the way of hydrating goals, because if you have 6 or 7 meals a day, then we're taking a lot of time away from drinking. Now, every program does differ. I said I would say that a lot, and even patient to patient, there might be situations where we do have somebody eating more often. But in general, we like to see 3 set meal times a day. Not to say you won't have a snack on occasion for true hunger, but to say that those in-between windows are the time to really focus on hydration. Now, what counts as water? Again, every program's different, but I like to say it counts as water if it's not carbonated, not caffeinated, and less than 15 calories for 8 ounces. Even herbal tea, hot broth, flavored waters, all those different things can count. That does bring up the question about caffeine. Now, everybody's different. Caffeine can be a diuretic, which means that it helps water leave your body more easily, making hydration harder. So I like to say you can have 24 ounces of caffeinated tea or coffee, so long as you're getting 64 to 96 ounces of water or a hydrating beverage. Carbonation is another big question, and that recommendation has evolved over time. Also, that it really has to do with if you tolerate it. So if a patient opens up a LaCroix or sparkling water and they let the fizz, initially kind of leave the can for a little bit, and then they sip on it and they feel fine, they're not having bloating, belching, discomfort, then you could count that towards water. And the same is true with drinking from straws. That used to be a no-no, and now it's more of a, if you tolerate it just fine and you're able to get more hydrating liquids because you're using a straw, then it is okay. It's not a no-no any longer. Okay, so we've touched on how much water, what counts as water, not drinking with meals, but let's also talk about other tips. So especially early out of surgery, we noticed that some patients really struggle with water. If you are getting really behind on water, we do want you to pay attention to symptoms of dehydration so you know when to go in and get IV fluids. So if you're feeling really lethargic, really dry mouth, really headachy, and especially if you're having severe lethargy, difficulty to arouse, those are even more severe. But when you start seeing some of those symptoms of dehydration, you really want to get going on your water, even if you have to go back to protein shakes, just so that you're drinking water all day long instead of stopping for your solids, if you're in a season of really need to get back to hydration. If you feel like you just can't dig yourself out of the hole, it might be time to call the nurse at your doctor's office and go in and get IV fluids, because the thing about being dehydrated is that it starts making water sound worse. So you're nauseated and you feel bad and water sounds terrible, and it's really, really hard to get hydrated again. So consider IV fluids if you're in that situation. Other tips for getting in more water is to pay attention to what temperatures do the best. So you might like herbal teas and hot broths. You might like room temperature. And you might like icy cold. You can try lots of different flavors. You can do, if you're tired of sweet stuff, you can do savory things like broth. You can even try a touch of doTERRA essential oil in your water to flavor it. It is food grade essential oil. That's the brand I like to use. So there's some tips. I hope it helps. I would also recommend different ways to track water. If you need a pen and paper water tracker, I've got one below for you to download, or you could buy a water bottle that has the measurements on it, or some will fill up a whole pitcher of how much they want to drink that day and pour out of that pitcher so they know it just needs to be empty. Lots of different ways to do it, but as long as you're getting water in, you're tracking it, pay attention to how it helps, because I really think it will improve the whole foundation of your health and strengthen the other pillars. Thanks for watching. If you haven't already, don't forget to hit subscribe on YouTube, join my email list, and stay tuned because we're going to cover meal planning and food quality very soon.